Antibiotic resistance is one of the most pressing issues currently in the healthcare industry. Other than doctors, researchers, and myself saying it is important, why is it that we care about this? Well, could you imagine a world where a scrape on your elbow could kill you, or stepping on a rusty nail? This is what our ancestors dealt with for thousands of years. It wasn't until a man named Dr. Alexander Fleming discovered the first antibiotics in 1928 that we did not have to worry about minor infections killing us, likely. When he returned from a holiday to find a mold that inhibited bacterial growth in one of his petri dishes, he made an amazing discovery: penicillin. It became the first antibiotic. Before this, people died during wars from infection more than anything else. During the Civil War, 620,000 people died, and 2/3 of that number were from disease. As more antibiotics were discovered, it seemed bacterial infections would be a thing of the past. The list of currently incurable infections is growing smaller and smaller. So why again do we care about this? Well, we have misused and overused these weapons of bacterial destruction over the years, and now they are launching a counteroffensive against us humans. The bacteria have begun to become resistant to the antibiotics we have been using for decades. A statistic provided by the CDC as of 2019 states more than 2.8 million antimicrobial resistant infections occur in the U.S. each year, and more than 35,000 people die as a result of this. And when Clostridium difficile, a bacterium that is not typically resistant but can cause deadly diarrhea and is associated with antibiotic use, is added to these, the U.S. toll of all the threats in the report exceeds 3 million infections and 48,000 deaths per year. Therefore, about 1 in 100 people in the United States contract an antibiotic-resistant infection each year, and it is only rising. There are often limited amounts of help that doctors can give to assist patients when they contract these infections, and this is why we care. My research has been to potentially discover novel antibiotic-producing bacteria in the soil of Minnesota in hopes of finding the next weapon doctors can use to help these patients. It is said that we have only been able to grow and discover about 1% of bacteria in labs. As most antibiotic producers come from the soil, there certainly is much more to be found. My soil sample was taken from Cannon Falls, Minnesota, and performed many tests to see if it could be containing medically important bacteria. The research I have been performing has been working alongside Tiny Earth Network, a network of microbiologist researchers across campuses, labs, and so on here in the United States. Their goal is the same as my research, to discover new antibiotics from the soil. My bacteria were found to be of the Bacillus genus, but did not produce any antibiotics of significance, nor did it exhibit resistance to any of the antibiotic patches we used to test against our strain. Although my bacteria did not carry any medical significance, many members of the Tiny Earth Network have found medically significant antibiotic producers. Of my soil sample, though, only certain bacteria grew, and as certain growth media and conditions can only cultivate so many species, and this is a problem for us in the laboratory. Some researchers are attempting to find new ways to grow bacteria in communities opposed to the traditional petri dishes. This will further our chances of finding new antibiotic producers. This will help further our discovery of new antibiotics by expanding our potential species that can be grown. And who knows, the person watching this video could be the person who discovers the next life-saving antibiotic. I hope to continue my antibiotic stewardship, and I hope that you guys have learned something from this video.